Hello friends, let us now learn some important points about M phase inhibitors. So in the M phase inhibitors, first we have two important drugs are important in M phase inhibitors. Two important group of drugs are important here. One, we have spindle formation inhibitors which are used in metaphase, whereas spindle breakdown inhibitors which are actually used in anaphase. In spindle formation inhibitors or which are used in metaphase, here these drugs include vincristine, which is actually, this vincristine is a marrow sparing. This vincristine is used in Hodgkin's lymphoma, pediatric solid tumors. It is used in acute lymphocytic leukemia. Then vinblastine is used in Kaposi sarcoma, testicular carcinoma. It is used in Hodgkin's lymphoma and non-Hodgkin's lymphoma. Arbuline is used in breast carcinoma. Estramustin is used in prostatic carcinoma. The side effect of this estramustin is it causes gynecomastia, has side effect. Then if you see the spindle breakdown inhibitors, then we have spindle breakdown inhibitors or anaphase inhibitors. These mainly includes the taxanes, which include paclitaxel. This includes paclitaxel, docetaxel. These taxanes include paclitaxel, docetaxel, cabazitaxel and ixabepilone. It includes paclitaxel, docetaxel, cabazitaxel and ixabepilone. Then first we will learn about the spindle formation inhibitors. These spindle formation inhibitors include, first we have vinca alkaloids. In the vinca alkaloids, the mechanism of action of vinca alkaloids are, these vinca alkaloids will bind to beta tubulin and thus they will prevent the polymerization of beta tubulin to form the alpha tubulin structures. They prevent the polymerization of beta tubulin to form alpha tubulin structures and thus inhibits the mitotic spindle formation. This will also arrest the cell division in metaphase and thus it causes apoptosis. So these are the main mechanism of action of vinca alkaloids. Then if you see the side effects, in the side effects, these vinca alkaloids causes bone marrow suppression. These causes SIADH, has side effects. Then vinblastine. In the vinblastine, it causes beta receptor of metastatic testicular tumor, Kaposi sarcoma, Hodgkin's lymphoma and non-Hodgkin's lymphoma. It is used, vinblastine is used in beta, vinblastine is used in beta, is used in metastatic testicular tumor. It is used in metastatic testicular tumor and also Kaposi sarcoma, Hodgkin's lymphoma and non-Hodgkin's lymphoma. Whereas vincristine is used in marrow sparing effect, has marrow sparing effect. It causes side effects of peripheral neuropathy and this vincristine is used in Hodgkin's lymphoma, pediatric solid tumor and in acute lymphoblastic leukemia. Then we have the next drug, which is Arbuline Missylate. This Arbuline Missylate is used in the treatment of breast cancer. It is used in the treatment of breast cancer. Estramustin is estrogen plus miclorethamine together. We call it as estramustin. This estramustin is used for the treatment of prostatic carcinoma. It causes the side effects of gynecomastia and impotence. It is used in the treatment of prostate carcinoma. It causes side effects of gynecomastia and impotence. Then after this drug, the next important, after this vincristine, vinblastine, the next important group of drugs are spindle breakdown inhibitors. Next, spindle breakdown inhibitors are important. So these include, first we have taxanes. Taxanes, mechanism of action of taxanes. These taxanes bind to the beta tubulin receptor at different site and these will activate, they bind to beta tubulin receptor at different site, and these will activate microtubule assembly, and these will also form bundles of microtubules, and the aberrant structures are formed. Bundles of microtubule and aberrant structures are formed. This will cause arrest the cell division. Thus these cells undergo apoptosis, and these cells are actually derived from, these are derived from yew tree or camphor tree. These are derived from yew tree or camphor tree. Earlier they are derived from yew tree, but now they are actually derived from camphor tree. Then we have paclitaxel. Camphor tree, because they are derived from camphor tree, there is associated with hypersensitivity reaction. Paclitaxel is derived from yew tree. This paclitaxel is present via genetic engineering with E. coli. This paclitaxel is a protein bound paclitaxel is used, which is NAB paclitaxel. This protein bound paclitaxel, which is NAB paclitaxel, this will decrease the risk of hypersensitivity. So this paclitaxel is used in the breast carcinoma, ovarian carcinoma, bladder carcinoma, and it is also used in head and neck carcinoma. Then we have the drug docetaxel. This docetaxel has no hypersensitivity side effects. This docetaxel is used in prostatic carcinoma. Then we have cabazitaxel. Cabazitaxel has resistance to efflux pumps. This cabazitaxel is used in the treatment of MDR tumors, that is multi-drug resistant tumors. Then we have ixabepilone. Ixabepilone is used in the treatment of triple negative breast carcinoma. This is ER negative, PR negative, and HER2 negative breast carcinoma is ixabepilone. This ixabepilone will arrest in G2M phase of cell cycle. This will arrest in G2M phase of cell cycle is ixabepilone. Then the treatment of breast carcinoma. For the treatment of breast carcinoma, stage 1 we do surgery, and then we give tamoxifen. In stage 2 we do surgery, and we can give CMF regimen, that is cyclophosphamide, methotrexate, and 5-fluorouracil. Together we give CMF regimen. Then we have stage 3. In stage 3 we have CAF regimen. In CAF regimen we have cyclophosphamide, adriamycin, and 5-fluorouracil. Cyclophosphamide, adriamycin, and 5-fluorouracil are given in stage 3 and stage 5. Then the miscellaneous drugs. Miscellaneous drugs include asparaginase. This asparaginase is a marrow sparing drug, which is, what are the marrow sparing drugs? Marrow sparing drugs include, we have vincristine, asparaginase, and bleomycin. Vincristine, asparaginase, and bleomycin are the marrow sparing drugs. So these L-asparaginase is a marrow sparing drug which is used in G1 phase, and it is used in acute lymphocytic leukemia. Side effect of L-asparaginase is it causes hypersensitivity reaction and acute pancreatitis. Hypersensitivity reaction and acute pancreatitis are seen as the side effect of asparaginase. So thank you guys for watching.